Hi, I'm Steve Rowe, Executive Director. Today is Wednesday, November 18th, and it is my turn to provide our weekly video update. I'm going to talk about five things today, the first of which is our testing results. As you're probably aware, most of our staff has been testing twice a week, with the positivity rate in Johnson County being above 10%. That is a requirement for us. And so we had tests yesterday on Tuesday, and all of our tests were negative and have now been negative for an entire 2-week period, which is good because that allows us to not have to test our health center residents. So while we're in an outbreak status, which means that somebody had tested positive, we are required to test our residents then at least on a weekly basis. So we're obviously very happy that we've gotten past this 2-week period with no additional positive employee tests, and now we don't have to test residents again until there's another positive employee test, which hopefully never occurs, but realistically, at least it's not happening right now. We do have a testing plan for immediately after Thanksgiving for our employees because they're more likely to be exposed during the holidays. And instead of twice weekly testing that is required, we're actually going to do 3 times a week testing. So we will test on Monday, Wednesdays, and Fridays for the 2 weeks following Thanksgiving. Our goal in doing that is to try to catch anybody who may have become infected and is not symptomatic, but just catch them before they become a problem and potentially infect anybody else. So we will increase frequency of testing to 3 times a week for employees right after Thanksgiving. Second thing I want to talk about, case counts in Johnson County continue to be very high. We had a period from October 23rd through 2 days ago, so 23 or 24 straight days of increasing case counts. It got up to, on November 15th, an average daily case count, new cases of 140 new cases per day over the prior 2-week period. I don't want to jinx this, but the last 2 days have been very slight decreases in cases. So hopefully we're past the worst of this surge and it starts to decrease again. I know with the holiday coming next week, that might be too optimistic, but at least for a couple of days, the case count numbers have gone down. Next thing I want to talk about, and apparently I'm not very good at math today. I said 5 things that I'm going to talk about. There's actually 4 things. The third thing that I want to talk about is a project that Kim Bergen-Jackson, our administrator, sorry Kim, is doing, and it is called Project Echo. Kim has been looking for opportunities for us to bring in some additional money, and she's been very good at finding grant opportunities and different things like that. Very early on in the COVID cycle, there was an opportunity for like a telemedicine type grant, and she found $3,000, and we put that money to use to make telehealth visits easier for people in the health center and in assisted living. She came across this Project Echo idea, and they were looking for people or organizations that would serve as coordinators. And the compensation that went along with that was fairly attractive, but it is a whole bunch of work. And what Kim is doing is basically coordinating groups of nursing homes. So there are 35 nursing homes in a cohort, and she has has 3 cohorts, so a little over 100 nursing homes across the state of Iowa who have committed to a 16-week training program. The curriculum had all been developed by the University of New Mexico College of Medicine, and was distributed, but they need people to kind of facilitate this learning opportunity. So every Tuesday, every Wednesday, and every Thursday, Kim is on a Zoom meeting with 35 other nursing homes throughout the state of Iowa, going through this curriculum and trying to educate other nursing homes about COVID prevention, what happens if you get it, how do you stop the spread of it within the nursing home, things like that. So it is not curriculum that Kim developed, but she is obviously spending a good deal of time learning the curriculum that has been developed and then facilitating the conversations. This is a great opportunity for Oaknall, and we thank Kim very much for leading the way. It's also a tremendous way for us to give back to the state, and there's a lot of communities out there that are hurting right now. And if you're a small nursing home in rural Iowa, someplace that doesn't have a lot of resources, this is at least some way to be connected to a network of peers who are going through the same thing. As I've talked with Kim about her experiences so far, she's in week 2 of a 16-week process. There are basically 3 groups of nursing homes. There are people and organizations like Oaknall that have not yet experienced a first positive case of COVID within their resident population. And clearly the goal is to never experience that first case, but we've got some organizations that are doing this that are in that first group, like Oaknall. There are other organizations that have experienced COVID within their residents, but currently do not have anybody who has it. And then there's a third group that's actually in the midst of battling an active COVID outbreak within their community. So this is just a really, really important and good opportunity for Oaknall to help to lead, for Kim to lead, and for us to share what works, what doesn't work, to share emotional support with people that might be in the midst of that outbreak. This is really hard work. It's been challenging and stressful for all of us for more than 8 months, and this is just a fantastic way, and I'm so proud of Kim for finding this opportunity and for leading this huge effort throughout the state of Iowa. So thank you to Kim for that. The final thing I want to talk about is Thanksgiving holiday coming up. We put out a communication a couple of days ago about the holiday and really encouraging people to not gather as they normally would. That was a really hard ask, and I'm sorry for that. And some people will absolutely take the advice of our medical director in public health and us and stay home and have a meal delivered from dining services to their apartment and hope for a better Thanksgiving next year. I know that there will be some people who go out and do attend a gathering, and if you are one of those households that does go someplace to share Thanksgiving, we just really encourage you to be careful and quarantine when you come back. So we can't possibly know everybody's activity. If you do go out and happen to have Thanksgiving with more than one other household, then we would ask when you return back to Oaknall that you quarantine for a 2-week period, and we will offer voluntary COVID testing on day 5 and day 12 as outlined in the communication from a couple of days ago. The cost of those voluntary tests will be $50 per test. We do not have a way to bill Medicare, but if you would like to get tested kind of at various stages through the quarantine period, we do have the capacity to do that now, and if that will help you feel more comfortable, please do it. I want to clarify one question that came up. So the question was somebody who has been going out from time to time to visit their daughter, just one person that they were going to visit, and if they go to visit their daughter for Thanksgiving, just like they may have visited their daughter last week, do they need to quarantine for that 2-week period after Thanksgiving? And the answer to that is no. If you're just visiting one household and the numbers are relatively small, there's nothing magical that it was Thanksgiving versus last week that would make us say that you need to quarantine. But if you are going to your daughter's and your daughter also has her daughter and kids or cousins, or it's like, no, there's more than one household at the place that you're going, that's when we really want to encourage you to quarantine. All of us have our bubbles where we feel relatively safe, and you kind of know the activity of the people within your small bubble. But as these small bubbles start to intersect, that's really where the danger lies. And so it's like if that small bubble includes more than 2 households, we certainly want you to quarantine when you come back. Test if that will help you feel better, and enjoy this Thanksgiving for what it is. We're alive. A vaccine is on its way, we hope, and hopefully next year will be much, much better for all of us. I wish you well. Thanks.